pop. How much? Where does it hurt? Like right there. This hurts. How bad is your pain? It's like a 7. That's a 7.
What type of pain is it?
It just hurts like a dull pain, I guess. I don't know.
And you said you heard a pop from it. Have you heard it before or anything?
Actually, it sprained my knee last June.
Did you do anything for it?
I went to the doctor and they told me it was a sprain. I didn't worry about it. I usually wear a brace, but I forgot.
Can you point with your finger to where it hurts most?
Just all over. I don't know specifically, like right there. That's
So I'm looking for obvious deformity. There's some swelling. Tell position is normal. Gait, she can't stand, she feels unstable. There's no bleeding, bruising, or scars anywhere. Exterior floor. Look, you have a positive blockage and a positive anterior force. It looks like it's a tear of your ACL. You're going to stop playing basketball for a while. You're going to rest it, ice it, compress, and elevate it. And you're going to see Kate tomorrow because I'm not in the pain.
Hello? Kate here? Right with you. If you can.
Okay, so Amanda told me it looks like you might have torn your ACL.
Yeah.
Alright, so can you tell me what exactly happened yesterday?
Well, I was practicing the basketball and I was doing some drills and I went to cut and then I heard a popping sound.
Okay. And what was your pain at yesterday? You said around a 7?
Yeah.
Okay, and what's your pain today?
About the same, 7.5 to 8.
So that a little worse?
Yeah.
Okay. And Amanda said there's a little bit of swelling.
Yeah.
So it looks like there's a little more today. And does it still hurt in the exact same spot?
Yeah.
Okay. And what type of pain is it?
I don't know. It's all pain.
Okay, so
It
just
just hurts a lot.
does it hurt more on the inside?
Yeah.
See. So there's an obvious deformity here. It looks like your tibia is a little pushed back. There's obviously some swelling going on, like in the under floor. Still just a little discoloration, not too much. Everything else is looking all right. So we're going to do our palpation now. So I'm going to have you slide back. All right, and we know that you can't extend your knee all the way, so right there's fine. All right, and go around here. Going to palpate your bad knee, your good knee first. Okay. So this patella is all right, everything in here. So you'll keep off these, your joint line, no pain in your joint line. Tibia is all right.
Hurts like right.
Like in here?
Yeah.
Does it hurt on the actual knee or does it hurt more on the inside?
More on the inside.
Okay. Anything in here?
A little bit.
Alright. Where your joint line is more towards the middle of your joint line?
Yeah.
Oh. And anything up in here? No? Alright. So nothing in your femur. Alright. So we're going to do some range of motion. So we're going to use our damiometer and see how much extension you can get. Is that as far as you can put your knee down?
Yeah.
Okay. Alright, so you cannot fully extend the knee. Let me check the other knee. Can you fully extend this knee for me? Alright. So this knee's looking good. It's just going to stay where the line is at. Alright, and can you bend your knees alright? Alright, I'm pretty sure that's due to your swelling in there. Okay, so we're just going to go over some special tests with you, okay? It'll be the same special test that Amanda did yesterday. We're just going to recheck and make sure everything's alright. I'm going to start on your leg and move you down your leg. That is not injured. You want to just have you bend your knee?
Yeah.
And do an anterior drawer motion on your leg and then a backward. Okay. So everything's tight, nice and tight in here, so that's good. We're going to do a lock in, so like just like. Alright, so everything's good in there. Now I'm just going to try it on your injured legs. You can bend this leg for me. There we go. I'm just going to sit on it. Is that alright? Oh, there's a lot of movement there. Okay, now we're going to try lock in. We get a lot of movement in there too, so that's why we're concerned really about our ACL. I'm just going to text some other structures, just make sure you didn't do anything else. I'm going to go back to the uninjured leg. Go sit back on your chair and do a posterior one now. Okay, so there's still no movement. We're going to check your MCL here. No movement in there. And your LCL here. Alright, so no movement in there, so that's looking good. Now we're going to check your injured leg again, okay? So hopefully these don't bother you, because these are for the LCL, MCL, and your PCL, other structures in here. Okay, so nothing there. Check your MCL. Nothing in there. And your LCL. So there's no pain with them? Alright, and they all look fine. Okay, so we're going to let your knee go out again. This is a ACL tear. So the only way to confirm this is you would have to go get some imaging done on your knee. So we're going to send you for that. I see that you gave you crutches yesterday. So you're going to continue to use the crutches and non-weight bear, and they should be done within a week. So I'll send you for an evaluation and to see the doctor. So then I want to see you back here in 1 week and make sure you still ice and compress and elevate that leg, okay? All right. Thank you.
Thank you. Appreciate it.
Hey, how are you?
Feeling a little bit better. I've been icing it and everything.
How about on the table if you can, I'll take your purchase. Alright, so I just talked to the imaging people and they told me that they have confirmed that it is an ACL tear.
Okay.
So this means that we're going to have to get surgery to repair it. So we talked to Dr. Lake and they said that you set up an appointment for surgery in 3 weeks. Okay. So basically what we're going to have you do is after your surgery you'll come in and you're gonna do some rehabilitation stuff in here. But before that, just to ensure that you have a speedy and a good recovery, we're gonna work on strengthening your quads and your hamstrings. And so altogether, it could take about 6 months for you to be back to gameplay. I know it seems like a lot now, but it's better to get this done when you're young and get it out of the way than when you're old and not as recovered. All right. So I'm gonna go grab a low weight pad, and we're gonna work on trying to strengthen those quads and hamstrings. What we don't want to do is we don't want to put our weight on anywhere near the lower half of your leg, just because that's going to cause more pain to the ACL. So we're going to apply this here up the top of your leg, and we're going to have you slide down and hang your foot off the side. Okay. Now what you're going to do is you're going to bring your knee up and to your chest, and we're going to do 2 sets of 10 of those, okay? And let me know if it gets to be too much. Take your time.
A little bit expected, yeah.
Alright, we can just do a couple more.
Should I hold it when I get to like the top, or?
We're going to do the first set regular, then the next set we can hold up there for 5 seconds instead of 2 and hold it. Alright. Okay, that's good. Okay. So we're going to leave this on here, and we're going to have you stand up on this leg. Use the table to support your other leg. Don't put this leg down. And we're just going to have you go to the side, so face me. And we're going to have you bring your leg back like this, your injured leg. Yep, keep your hips up straight. There we go. Hold on to the table for support. Yep, and this is going to work on your hamstrings and back there.
Like straight, right?
Yep, and this makes sure the muscles around your ACL are tight, and to make sure that you're more stable and you'll be better from the other surgery. Painful?
Yeah.
Alright, we can stop there for today. And we're just going to make sure that we come in every day until surgery. We're going to work progressively to get better at this. We're going to make sure we still ice, compress, elevate, and we are going to get you ready for surgery, and then we'll see you right after surgery, okay?
Okay.
Alright. So we're just going to unwrap this and take a look at it. We're not going to be able to do too much today just because there's such fresh and open wounds that we don't want to mess with anything that they just did. Stitches in there. So these will probably come out in a couple weeks or days. Alright, so what we're going to try to do today is you're just going to try to bring your knee and straighten it as much as you can with it feeling comfortable.
Should I sit back more?
Yeah, Jack. So you can go a little further?
Yeah.
Alright, so that's looking pretty good today. Yeah, and it's definitely looking like it's nice in here. Don't want to get too close to the stitches. Alright, so overall everything's looking good. So what I'm going to have you do is I'm going to put this band back on you, and then we're going to ice for today. So that'll be all you do, and then we can come in tomorrow and work on some